The signs of a stroke include, but are not limited to, inability to maintain balance, difficulty speaking, droopiness or numbness on the side of the face, all of the symptoms we will see this patient experience. Although receiving anesthesia can give a patient these symptoms, it is crucial to learn and differentiate a stroke from a regular and normal dental procedure. Let's take a look at a scenario where we can detect the symptoms of a stroke and act on them quickly as professional hygienists.
Okay, so I'm going to give you a rinse here. Gut open and close your lips. Is that okay for you?
Yeah.
Does it taste better anymore? Okay. So we are going to wait about 5 to 10 minutes for the anesthesia to take effect, okay? You feeling all right?
Yeah, I feel fine.
Okay.
Can I use can I use the restroom before we get started?
Yeah. Do you remember where it's at? You want me to show you?
I remember where it's at from last time. Thank
Go
you.
ahead. You're welcome.
When the patient returned from the restroom, she was unable to maintain balance. The patient then takes a seat in the chair but is having a hard time speaking. She also feels that the right side of her face is much more numb than usual.
Are you doing okay?
I think so. I'm just so numb. I feel like I can't even talk right.
Okay. Are you able to see normally?
I can't really see out of my right eye very well, but could that be because you numbed me in my right side?
At this point, the hygienist should stop and assess the patient using FAST. This is an easy to remember strategy that is recommended by the National Stroke Association that is used to help determine if someone is having a stroke. Do this without worrying or alarming the patient. We'll start with F, which stands for face. At this point, ask the patient to smile and take notice if the face drops to one side.
Yeah, so that sometimes could happen since we numbed you right up there. Let me have you give me a big smile like you just won the lottery. Okay.
Next, the hygienist should ask the patient to raise both arms. This is the A in FAST. She will take note if one arm drops or drifts downward.
Okay, good. Let me have you lift both of your arms for me, high, and then just keep them there. And can you go a little straighter? Okay.
See, the patient cannot keep the right arm up and the smile is crooked. There are 2 more assessments to confirm that this patient could be experiencing a stroke. The hygienist will then ask the patient to repeat a sentence after her, the S in FAST.
All right, good, thank you. So let me have you repeat after me, okay? I love getting my teeth cleaned.
I love getting my teeth cleaned.
Okay, good.
The hygienist has taken note of all the symptoms that show this patient is having a stroke. The hygienist needs to let the instructor or Dr. Schneider know ASAP, as well as call 911.
Dr. Schneider, I think my patient is having a stroke.
Okay, tell me what's going on.
Okay, so I anesthetized her for the cleaning. She went to the restroom. Everything was fine until then. She came back wobbling a little. She sat down, started talking a little funny, but we're thinking it might have been the anesthesia.
Sure.
So I did the FAST assessment. I had her smile at me. Her lips were crooked. Then I had her repeat a sentence after me. She couldn't say it very clearly. And then I had her raise her arms, and the right one was drooping down. So
It definitely sounds like it.
Right.
I'm going to call 911. You go stay with the patient, make sure she's okay.
Okay.
Monitor her vitals.
Okay. Cassandra, how are you feeling?
I kind of have a headache.
So I think you're experiencing a stroke. We called 911 and they're on their way. I'm just gonna take some vitals on you, okay? See what numbers we're getting. I'm gonna put you down here. Sorry, it's a little bumpy. Okay. Let's start with your temperature. just take your arm from me, okay?
What did you say was happening?
So we think you're experiencing a stroke.
It will be important for the hygienist to take vitals until EMS can arrive. As we can see, the hygienist will take the patient's temperature, pulse, and their blood pressure. She will also administer 4 to 6 liters per minute of oxygen.
Okay, now have you put your arm back. I'm gonna take your blood pressure next, okay?
In addition to taking vitals, the hygienist should use a glucometer to take the patient's blood glucose levels. This is because hypoglycemia can also present very similar symptoms and signs to that of a stroke. If a patient presents diabetes in their medical history, be sure to check their blood glucose levels before using the FAST assessment.
Okay. So next, I'm just gonna put some oxygen and you breathe in and out through your nose, okay?
The types of stroke a patient can experience are ischemic, hemorrhagic, transient ischemic, cryptogenic, and the brainstem stroke. The ischemic stroke occurs when a blood vessel that supplies blood to the brain is obstructed. It is the most prevalent of strokes, accounting for 87% of all strokes.
Ischemic strokes most often occur in patients with high blood pressure, high cholesterol, diabetes, and or if they smoke. Many of the patients we will see in clinic fall under some of these categories. Understanding the signs and symptoms is crucial in protecting patients and avoiding dental emergency disasters.
Observe their face, arms, and speech, and if necessary, take action and call 911 right away. Becoming educated and continuing education about diseases and their symptoms allows for a safe environment in case emergencies do arise.
Many times in the dental office setting, shakiness, numb-looking lips with the inability to talk, imbalance from vertigo are common things to occur. These things could be easily confused with normality and a stroke, even a silent stroke.
Don't wait, act fast!